Thank you, and good afternoon. I know that there has been a lot of excitement around the speed and scope of the reopenings, but I want to sound a cautionary note that the dangers from coronavirus remain as real today as they were in March. While we have done a very good job as a region in our initial response to coronavirus, and thus far in our reopening, in San Diego we have done well, there are 10 counties in California that have been flagged by the state for additional monitoring due to increases in transmission of COVID and or increases in hospitalizations. And while we are not one of these 10, this does tell us that there is an increase in transmission in a number of counties that are opening throughout the state of California, and it's a reminder to us of the need to be very vigilant and be very cautious, especially as we move into higher risk type entities that are opening. These increases are not just Los Angeles County. As of Tuesday, Orange County saw an average of nearly 400 people hospitalized with COVID-19, which is up 100 from where they were in May. Ventura County saw a doubling of their COVID hospitalizations from Friday until Monday. And while we are all in a much better position on PPE, testing, ventilators, hospital surge capacities, and other issues, we want to be mindful that in order to have a smooth recovery and reopening, we have to responsibly do it, and we want to continue to implore the public to please do everything you can to adhere to the measures and suggestions that have been put out and the public health orders that are in place. We're also mindful here in San Diego County that not every region of our county is being impacted the same. We have some regions that are seeing much higher cases and much higher hospitalizations and are being hit much harder than others. And so we're not out of this crisis yet. We still have a long ways to go, and we need everyone to be as safe as possible as we go forward. This will not only protect life, but this will protect our ability and give us the strongest possible chance to have a smooth and steady economic recovery as well. With that, let's jump into before we jump into our numbers today, a quick note on testing. For about the last 2 weeks, we've had challenges with getting the negative test reporting from the Optum drive-up or walk-up testing that the state of California has helped facilitate. The positive cases have all been contacted, and our incredible department and our epi labs are doing a good job of contacting them, notifying them, and contact tracing them, but it has impacted our testing numbers. So our numbers the last 2 weeks have not fully reflected all of the testing that has been done because we've had a little breakdown in the system in getting the negative numbers reported back to us. We expect that to catch up in the next 24 to 48 hours, and then I think we'll see a retroactive increase in testing that's been done, but did want to provide that information, and once we get those, we will share with you how many of those are reported and on what date. But let's jump into what we have for today. As of today, we're reporting 3,854 tests being done. Again, being mindful that those state drive-up testing are not included in these test results. For an average of 4,415, you see 436 contact tracers, and then our public health motel rooms under our treatment effort. For today's totals, we're reporting 108 total positive tests out of the 3,854. That is a 3% percentage positive. Again, you can see the orange or the purple line there tracking reasonably flat for about the past 2 weeks. Hospitalization daily census, ICUs down a little bit, non-ICUs up a little bit. Total COVID-related holding reasonably steady and flat. If we go to the next one, we can look at our COVID hospitalizations there at the bottom at 373, non-COVID, and you see an increase of just over 4,000, 4,019 for our total hospitalization census, as it is relative to that 80% bed capacity trigger that we've outlined. And then when it gets to ICUs, you can see the COVID-related ICUs down a few, non-COVID-related ICUs up a few, yesterday to today down a few, but again holding reasonably flat. ICU bed occupancy at 66%. That concludes my section of the report. I'll now turn it over to Dr. Wooten for her Public Health Officer's report.